Hi, my name is Jacob Lineberger. I received my bachelor's degree in philosophy at Florida International University and currently pursuing my master's of health service administration at FIU as well. I'm a motivated and meticulous administrative leader with 4 years of ambulatory experience. I have great multitasking skills and strong critical thinking skills. I'm a very emotionally intelligent person, very professional when it comes to my work. Um, I'm Lean Six Sigma certified, so I am relentless in coming up with creative and easier alternatives to a standardized process and improving efficiency. I'm always looking out to see how we can be better. Where there's always room for improvement in any type of process. There's always waste that we need to look at just to improve the efficiency and create a better experience. About myself, I am a strong believer in respecting peers, leaders, subordinates, patients, maintenance crew, and the lady that works at the coffee shop, any person I interact with. It's important to treat others how you would like to be treated. It goes a long way in the eyes of the patients and coworkers in the end, especially in a patient-centered, creating a patient-centered culture. You want to give that customer service experience to our patients. Um, it's about the perception of care as well. So the going out of your way and respecting the patients is a big factor and a big value to me. I'm also very independent. There's no need for my managers and coworkers to micromanage me because they know that I am a person who will be proactive. Um, I do what's asked of me and more. I'm always again looking for tackling issues as I see them developing and coming up with alternatives to improve our workflow. I'm also meticulous. Being acting professional takes a lot of hard work. From the moment I clock in to the moment I clock out, I come in to do my job and provide my knowledge and skills to make our clinic overall better. Um, I think my coworkers can back up my hard work. Always the go-to person for the three clinics that I run. Um, and it does take a lot of work. It's a lot of different issues that come up with running three different specialty clinics, and um, you have to think on your feet. It's a lot of different issues, but without teamwork, which is another value that I consider of mine, is um, these clinics can't run on their own. You need the help of the nurses, the providers, the administration, the cleaning staff, engineering. It's all connected. Without one, it's all gonna crash and burn. Many times you run into staff shortages, and you need teamwork to step up. You get the job done. There's times where I've had to do stuff out of my job description, clean rooms, and to ensure that the work is done. You can't be afraid to just stick to what your job description is sometimes. Of course, you don't want to overstep your boundaries of, like making medication recommendations. That's something the physician should be doing. But something that's stepping out um, and helping your coworkers goes a long way. And um, so one thing that it's been an issue in the current gastroenterology clinic is a lack of communication um, and compliance with patients. So I was tasked with keeping track of uh, patients' procedures of when they're scheduled. Patients would be coming back to their visits without having done anything the doctor asked of them, not scheduling any of the uh, imaging studies or lab tests that they ordered, and it makes the visit like makes it worth not valuable. Um, so I created a Excel sheet. It's divided each sheet is divided by the months. So I have February, March, April, May, June, all the way until the end of the year. And in each sheet, I have columns set up, which all information includes is the patient's first name, last name, medical record number, phone number, their provider that they see, because we do have 8 gastroenterologists, the date of service, and their next visit date. So if their next visit date is February 28th, they'll be on the February the February sheet, and every column is also includes um, all the different types of procedures that we order. If it's labs, CT, MRI, gastric emptying studies, colonoscopy, endoscopy, or both, um, esophagograms, it's all there, and I include all the dates of when they're scheduled. And I use conditional formatting on the Excel sheet to help me track how close the patient's procedures and tests are scheduled for. So as they get closer, it goes from green to orange, green, yellow, orange, red, as soon as it gets closer. And then I could see when is the patient coming back to us, and kind of follow up when their procedures are scheduled. If I have to call the patient, I have the phone number there on the Excel sheet to remind them, hey, you have your MRI coming up. Make sure to go here on this date, and advise them. If they missed it, if I see that it's red, and when I go into our system to see if they went and they didn't, I help them reschedule it, so that way, they're not coming into their visit without having done what the doctors asked of them. Um, so far, it's been working. Day of the clinic, so the clinic is once a week, Friday mornings. Um, we have patient stickers to identify them. So I'll take a sticker from each of the patients seen, and then I have a sheet where I put the sticker, and next to it I have a table with the different procedures the doctors could have ordered. I write down the date it's scheduled, and then the next office day, I put all that information into my Excel sheet, so that way we have better control of when are these patients being scheduled for their procedures, and in an easy manner. It's not just written down on a notebook. It's all put into an Excel sheet that's with conditional formatting that's easier to track. Another thing that we've been pushing more for is, patients used to leave their clinic visit with just an appointment in their hand. They would make the appointment and send off the patient. But we do have discharge instructions, and they haven't been being distributed to the patients. And that could also be a reason why the patients have not been coming to their appointments without having anything done, because all they have in their hand is their next appointment date. But with the discharge instruction includes like what the doctor ordered, all the other appointment dates that they have, some information about the current visit or the visit that they just had. So it's giving the patients better education and better understanding of their care. So that way, when they come in to the next visit, they also includes phone numbers if they want to schedule or reschedule any of their appointments, procedures. It has other educational material that's also really great. So that's another thing that we've been utilizing to better get patients more compliant. And as another thing was that we started including was the doctors didn't have access to patients' labs the day of their appointments. So we do that beforehand during the week to pull the record. Like if they have to go to Quest or LabCorp, we make sure we have that information readily available the day of clinic, not pulling the information as the doctors requested. So it's already it's there ready for them. So it's been overall doing better. The doctors are happier with the teamwork and the hard work we've been putting in to create a better communication between providers and the patients. We also started, the clinic was shared with rheumatology and dermatology clinic. So, and it was only to one phone number, but now there's 3 different lines for all 3 clinics. So if they're trying to reach a gastroenterologist, we also made business cards so that way patients know which number they should be calling, and then when we get phone messages throughout the week, we use the messaging system built into the EHR to message the doctors. So that way, when patients call, the messages are being routed to them like that, and it's being saved onto the patient's chart. So the way there's better documentation and better tracking of messages and communication between the providers and patients, and they've really enjoyed that as well. It's been a great help in accountability and patient satisfaction.